In Japan, even here now, they need black men there to produce children. So some of these doctors can do a side income job to produce children there and also treat the aging population. In Korea, they are also having a problem of interns. I think you have seen that. Do your research. South Korea, they are also having this prolonged strike. Okay? In North America, in Europe, the populations are aging, meaning the young Africans must go there to work. For us, we can send doctors and they bring us money if the doctors are too many. But let us not block them. Mr. President, please, you implement that thing and send 1,000 doctors so that the government knows that there are opportunities out there where these doctors are loved and they can be quickly absorbed and paid good money, which they can send here and we help. I see every day now it's the people doing everything. If you have a police in the village, you're the one to give posho. I'm the chairman of my village there. I have to give posho to the police. I have to do this. So we can do that. We can do that. Thank you so much. Those are the remarks I just had
for this press conference today. Uganda Medical Association, Dr. Herbert Rusfata, President, Uganda Medical Association. We are alarmed by the government failure to deploy over 1,500 medical interns who qualified in 2023 and 2024. These include intern doctors, dental surgeons, as well as nurses, midwives, and graduate pharmacists. So despite the availability of internship placement sites, the Ministry of Health has cited a budget shortfall of 18.5 billion Ugandan shillings as a significant barrier to deployment. This is unacceptable, especially considering the consistent underfunding of the health sector in Uganda. UMA has the following demands: immediate allocation of a supplementary budget by Parliament so that the remaining interns can all be deployed. Improved planning by the Minister of Health and Education to ensure that we end the vicious cycle of strikes which come every year by the senior house officers and the medical interns. Enactment of an internship act, enactment of the internship and the senior house officer training policies proposed by Uganda Medical Association into law to ensure quality medical training and well-supported apprenticeship. We urge the government to prioritize the health of Ugandans by addressing these critical issues without delay. Just to add on what I've said, we learned from the press statement which was released by Minister of Health that there are about 15 new internship sites which were opened up with supervisors. We also learned from our colleagues from the different internship sites who told us that the number of interns who were allocated, more so the intern doctors, are very few, depending on the amount or the number of medical doctor interns who are required. And there are some sites which are currently complaining that for them they didn't even receive any intern doctor, despite deploying the nurses and other cadres. And up to now, they wish the government to give them intern doctors to support them, because these are the most critical interns they need in their facilities. So these facilities include, we have Bujiri, we have CKR, and many others. Actually, around 9 in total. So we think there is enough space to accommodate all these interns. Secondly, if the government can pass supplementary budgets to cater for many other things in this country, a social service like health should also be prioritized. We cannot say that the government cannot give a supplementary budget. It is unacceptable. We need health Ugandans. The Ugandans need healthcare services. They need to have enough health professionals in these health facilities where they are receiving care, and therefore that is a good enough justification for us to have a supplementary budget by the government and ensure that all the medical interns who are currently undeployed can go and do their internship. So let us have some additions from Dr. Mirembe.
My name is Dr. Mirembe Joel, the Secretary General of the Uganda Medical Association. In addition to what my president has clearly put, I want to say the following. It is in this very place, this very year, that I urged the government to allocate enough funds for the medical interns and the senior house officers because of the very core critical role they do in government regional referral hospitals, in government national referrals, and private not-for-profit hospitals. Of recent, they have added private hospitals like Seacare, which is a very good move. These are core doctors, core young people, trained well, graduated. They are not students. And I want to put that clearly to the media. But after that background, also, since 2016, we have been talking about these issues. And I should say, as leaders, as health workers, we are tired of talking about the same thing over and over again. So we want government to be serious. The habit government has learned to know what to do, but deliberately refuse to do it and wait for trouble. Wait for us to first wipe government. Wait for interns to go on the roads, on the streets, and be arrested and beaten. That is not acceptable. Government should really learn that, should stop that and act. Why? We have already, for the last 5 years, we have proposed workable solutions for this. And these solutions we are proposing have worked elsewhere. So on this particular issue, I want to emphasize what the president said. Government has created supplementaries for private companies which are going to make their own profits and give them money, like a company of sugar for the very many years and has never even produced a kilogram of sugar. Atiaka. This is the time government to run very fast and appropriate enough money to deploy these interns. The money available is enough to deploy them. So government in the next or third quarter should bring a budget. The money available is enough to pay all of them for the next at least 6 months. So now, what do we propose? Government should first deploy all of them. 2, look for ways to get money to pay them in the last 6 months. And 3, government should put up a proper plan to track admission of medical students into all universities, private and government. Then track their progress in studying, such that by the time they finish 5 years, 6 years, we know how many are they on estimate, such that the planning departments work well. But this is not in place and we have said it over, so they should plan for that. So, and then the other things have been said by the president. So the tracking is very important for planning purposes. What is the National Planning Authority doing? What is the Ministry of Health Planning Department doing? Thirdly, there should be a collaborative effect, a tangible collaborative effect between Ministry of Education, which trains, and Ministry of Health, which is the user, the end user. Those should come out clearly. Otherwise, government is making Ugandans look, the health care of Ugandans look a minor issue. Because why? Let me give you myself as a testimony. This month, we have just finished, and even now, I have been suffering with a severe dental condition. I have been solely worked on by intern dental surgeons here at Mulago. I'm a doctor. I even have access to consultants. But because these are trained, we trust them. Myself, you can check the Mulago records. I have been solely worked on by an intern dental surgeon. I have access to colleagues, special consultant dental surgeons, okay? But because these are trained people, I am personally a teacher of medical students at Ernest Cook University. I also teach here at Makerere as a volunteer tutor. These are people we have trained, we trust them, they have graduated. So they should not be treated like a by the way, please. So we call on government and all its agencies to respect interns. We don't want to see interns on streets again. We don't want them to plead to be deployed, to be paid, because they deserve more than what they are currently being paid. Thank you very much.
So my name is Dr. Obuku Ekwaro. I'm the past president of the Medical Association, and I'm happy the president invited me to just stand with them, because in 2016 we wrote a similar, advice to government of Uganda, and when he asked us in what we call the National Governing Council to give comments, I said, no, this paper we wrote it already, maybe you can edit it. And he said, come for the press conference. So the problem, by 2016, we had predicted that by 2020, there will be 1,000 doctors every year.
Which is true.
And now we are having over 1,000.
1,200.
Which is very good, because we need to have doctors in the village. Because doctors guarantee quality of care, which is what we are after as Medical Association, to support government programs to deliver care to the people. The good thing, the public service has come up with a policy, the government, to put doctors at Health Center 3. Doctors now are found at Health Center 4 and hospitals. And therefore, the intern doctors who are fresh are the best after their training to go to the rural areas. These seniors here, they don't like to go to those rural areas because they have seen Kampala. They want to hang around the good life and Wi-Fi and all this kind of thing. So it's very important that government invests in the young doctors, so that they are able to be attracted to go to the rural areas. Something that is very important that should not be ignored is this problem has been there. It is not a new problem. And these young people, we see them marching on the street. We cannot stop them, because they are in a very difficult position where you are promised that education is the key. And then you find that after you have finished your education, someone has locked and thrown away the key. Medicine is a very difficult course. It is the most difficult course. You have 2 degrees in surgery and in medicine. You study 6 years minimum, including the internship period, because in a way it is a study, although you're a qualified medical doctor, and you have to serve people to save lives. So that is one important thing. The other important thing is these young people are seeing what is going on. There is a perception that there is a lot of money in the government, but the money is being used for corporate social responsibility. You know what I mean? Parliament is allocating itself all this money everywhere except where it is needed. So these people here, these young people, are wondering why this money cannot be given to them. All these corruption cases that are being talked about, they are over 18 billion shillings. So the young people will wonder, why can someone be corrupt and bring that corruption money for internship? We shall strike for that person and say, please, you continue with your corruption and bring the money for internship. But people are using that money for personal interests. The final thing is that we have to plan ahead. The numbers are increasing. This is inevitable, but it's a good thing. It means Uganda is supposed to be a good country, because if it's not a good country, people don't produce. Okay, people don't live longer. The economy does not grow. But the way the economy is growing to one side. If you look at the UBOS, the recent census, there are areas which are becoming more poor. There are people who are becoming poorer, and studying medicine and engineering is increasing your chances of becoming poor in Uganda, because money is put elsewhere. Money is not put to those who are the best in class. Money is put now in politics. Anybody, if you go to primary one and you ask anybody, those children, what do you want to become? They'll say, I want to become a minister. Those days they could say, I want to be an engineer. I want to be a pilot. I want to be a medical doctor. I want to be a teacher. You know, a teacher actually in Finland is the highest paid. But if you come to Uganda, they are suffering. So the professional the professionals are at threat. The politicians are drinking everyone and telling them they are the most clever. They are the ones who need the money. And this problem, by the way, is in East Africa, perhaps except Tanzania and Rwanda. But also in Kenya, it's the same disease. So we need to think carefully how we solve the problem of the youth, because these are youth. They are youth and they are skilled youth. They need jobs. The most immediate job is internship because it limits them. And after that, the president told me the Uganda Medical Association has registered a company to export these doctors. We can export them and they send us foreign exchange here, where they need them in Japan,